example, we talked about in the series that we have purgatives and we have laxatives. In today's lecture, we're going to talk about when exactly we're going to use purgatives, when exactly we're going to use laxatives, when exactly we're going to use it for a short-term purpose, for a long-term purpose. When a patient comes to you with constipation, is a very common symptom, I can say. The recent presentation, like for example, everyone comes across the constipation someday in their entire life, but that isn't because of the dietary problems and because of the irregular fiber intake. But when we talk about chronic constipation, there we will have to rule out the organic causes, and that also we're going to be having a word about today, because constipation not only creates a GI problem, but constipation is also linked with various other neurological disorders also, electrolyte abnormalities also, endocrinal disorders also. That is what we're going to be having a word today. As we already have been aware about, constipation is the word which can use to describe, I can say, the disorder of bowel motility. We will have to take a proper history, like for example, if the patient has got what is a dietary history, what exactly is the type of stool, is it a hard stool, is it a soft stool but a very less quantity. We also have to take a full detailed history about history of similar episodes in the past to rule out the organic problems. Like for example, constipation can also be because of a secondary disorders, like for example, we have anal fissures, or it can be a cancer, anal cancers. It can also be inflammation of the anal canal, like proctitis. Their patient can have a chronic constipation. Constipation, I can say, can also be very commonly associated with the metabolic disorders. I'm talking about the chronic constipation, not an acute. Acute one, so हर किसी को कभी ना कभी there is the possibility that everyone is going to come across constipation someday in their life. So when we talk about the constipation, we have to understand that chronic constipation can have certain etiologies which can be very common, which is related. Like for example, metabolic disorders like diabetes mellitus can also be linked with constipation. We also have the disorder in which metabolism is reduced, like for example, hypothyroidism. When the patient comes with chronic constipation, also rule out the thyroid disorders. It also is very commonly related with increase in the calcium levels, hypercalcemias, which is linked with, I can say, hyperparathyroidism, hypervitaminosis D, which are linked with hypercalcemias. So, if the patient has got chronic constipation, think about ruling out this particular problems. Metabolic disorder. We also have certain neurological disorders. Why we exactly are discussing this? Because if the patient comes with chronic constipation, we will have to think about these disorders and then we can start the treatment. What are the neurological disorders? Like for example, we have the Parkinsonism, old age, because there we have muscles are becoming weak, muscles are becoming incoordinated. You can be in incoordinate action, reduced bowel motility. Sorry, can also be a problem. Constipation can also be because of the spinal cord disorders. Old age there can be a possibility. Chronic constipation can also be because of drugs. Like for example, many opioids are linked with, like dextromethorphan, like codeine, noscapine, because they reduces the bowel motility. Constipation can also be side effect because of an iron therapy. Constipation can also be because of calcium channel blockers. Very commonly patients are taking these drugs. So detailed history is important, because very many a time changing the drug, alternative therapy of this particular drug can result into treatment of constipation. So every time you may not require a laxative, every time we may not require a treatment of constipation, but especially in case of chronic constipation. एक बार अगर patient constipation करके आता है तो we are not supposed to rule out this thing. कोई जरूरत नहीं है. But if the patient coming to you with chronic constipation, then we will have to think about ruling out these particular problems. Can we also take a screenshot about this chronic constipation के causes? Because sometimes practically this may also be very important in your practice. Now, अगर organically देखा जाए, let's say for example, let's dig down what exactly are the two